Welcome to the 19th episode of the Story Project podcast. I am your host, Joanna Scott, and I'm so excited for this conversation with a dear friend of mine. Before I welcome my guest, I want to tell you a little bit about her. With nearly 3 decades of experience in the dental industry, Crystal Spring is an innovator and influencer in the mobile and public healthcare industries. Crystal is the founder of Smiles Across Montana, a nonprofit mobile dentistry organization that serves the state with access to care programs that are changing lives and building bridges between public health and organized dentistry. She is also a co-founder of RISE, an organization that inspires healthcare professionals to navigate professional passion and purpose. Her diverse resume also includes grant writing, speaking, and interprofessional education. Crystal and her nonprofit team focus on a whole health approach to preventative services and work diligently to advance medical dental integration into the healthcare system. She works with several nursing schools to add the use of innovative technologies such as the use of intraoral cameras, teledentistry, oral cancer screening, and preventative oral health services into their curriculum. Crystal is the past president of the Montana Dental Hygienists Association and has served on the ADHA Board of Trustees. She serves on the RDH Editorial Advisory Board. Recognized as a key opinion leader, she is frequently featured in industry podcasts and publications. Through her speaking and mentorship programs, Crystal's spirited approach to leadership and advocacy shines through, as does her passion for public health, the advancement of medical dental integration, and optimal healthcare for all. Hi, Crystal.
Wow. Thank you. I felt bad for you reading all that. I was like, oh my. So, yeah.
Welcome to the Story Project podcast. I am so honored to be sitting here with you today at your home in Montana.
I feel honored that you're here. I love your team. This has been so much fun.
We have had the best day with you, with your entire team that came in from all over the place. And then we're at your home. She lives on a ranch. So basically she's probably one of my coolest friends ever. I don't have another friend that lives on a ranch in Montana. So this has been a really just like special experience for myself and Studio 88 for sure.
Yeah, well, we were blown away by what you've done for us. So this has been a really great experience for us too. So, and I invite people here all the time. Like, thank you for coming.
Yeah.
Thank you.
Yeah. Now I can say I did it.
Yes.
And it was my first time in Montana. So that makes it kind of extra special. Yeah.
Completely. And you came to the best place.
Yes.
Like, Bozeman's amazing.
Yes, for sure.
Don't tell your friends.
Okay.
No, don't tell them. No.
Okay.
Just kidding.
Well, I always like to start with how we met, which I believe was a couple years ago at the National Mobile Teledentistry Conference with Sonia Dunbar and Melissa Turner.
Yeah.
And that's definitely like one of your biggest tribes, right? You have
Definitely. I think it's hard. It's kind of lonely and mobile, and yeah, that's always been important to me. Like that group of people, I really love that, and then I think where we really bonded is through Do.
Yes.
I know we both feel really strongly about that. Like I go to the Wednesday morning meetup.
Yeah.
Like that's been a huge part of my life.
Well, I am a raving fan of Do. And the Do Retreat, which is in October, you should sign up for that, right?
Yep,
we will both be there.
Definitely. It's going to be my birthday and I'm going to be there because
okay.
I love it so much.
Okay.
Yeah, I love Anne. I love that whole crowd.
Yeah, I do too.
And all the meetups we're having at other meetings, you just feel like you have like friends there.
Everywhere you go. Yeah, absolutely.
It's really amazing.
Okay, well, I want to ask you just a few fun kind of like rapid fire icebreaker questions. So, how long does it take you to wash and dry your very long hair? Because I really want to know. Is it like a really long process?
Well, I should do it more than I do it because it is kind of a big deal. And yeah, that's I don't know. I don't know. I just don't know. It's different all the time.
It's not worth timing.
No, I've never timed it. Sometimes it'll air dry, and then sometimes it just depends on like what kind of mood I'm in.
Well, you have really pretty hair.
Thank you.
Yeah.
Thank you.
What is your favorite fashion accessory? And if you guys have seen Crystal, you have great fashion, and especially
I really love hats.
Yeah.
I love hats a lot.
Yeah?
I would say hats or belts. I get excited about both of those, like a lot.
Okay.
And you saw we had them all out on the table. It was kind of gross, like excessive, maybe.
I don't know that it's gross. I'm borrowing one of Crystal's hats for this interview even right now. And it took me a few tries with multiple hats to get one to fit on my head. And I never really saw myself as having a big head. But what's his name again?
Houston.
So this is Houston.
He's a cow dog.
If you're watching this on audio, you can't see this, but he is he's one of Crystal's sweet little pups on the ranch.
Yeah.
He's joining us for
he's something else.
this episode. Oh my gosh. Okay. What is it like waking up to this view? So you've been here 18 years, right?
Yeah.
Okay.
So I grew up in Montana, and so did my husband. We're way older than 18, so it's been a really, really long time. I grew up in northeastern Montana, up in the plains. I don't remember in school, like, always looking up, but I remember from the minute we moved back to Bozeman, like, every time I'm driving somewhere, I think I annoy my friends from here. I'm like, oh my goodness, it's so beautiful today. It's so beautiful. Like, look, because it's just gorgeous here. Sorry. Yep, he's laying down now. Sorry, everybody.
Yeah. He's just happy. Happy little guy.
Yeah.
That's awesome. Well, you're officially my first guest who is a mom of cowboys. And I mentioned, of course, you're on a ranch. But I found out today your boys rodeo. So what is it? What is ranch life in Montana? What is rodeo life with boys? Tell us.
Yeah, so, we're not so much ranchers, technically, because people from Montana have a whole different idea, like huge spreads and sections. And,
Okay.
but we have a small little fun homestead. I don't know exactly what you'd call it, but it's a lot of work. So I would say we don't usually eat in the summers till like 10 o'clock at night. A lot of people are like, what? But the boys will be outside till pretty late if they're roping.
Yeah.
It's my husband's favorite thing to do.
So by roping, you mean roping bulls?
Nope. So they
Roping.
rope calves and steers,
Oh.
and we actually do it just right over there. Like
Okay.
I showed you that earlier. It's kind of crazy,
Okay.
but there's a lot of horses here. It's pretty amazing. I love watching the animals. I love them all. Like
Yeah.
I have a lot of fun with them. We even have a goat. We have these crazy.
You have a
That dog
goat?
is nuts. Yeah, we do have a goat. But no chickens. I'm not into chickens. I think
Okay.
the hardest part is in the winters when my husband's gone. Because
Yeah.
it's cold and I get to you still have to feed, and
Yeah.
we have some strong rules about like you don't eat till the animals eat, and that is
Oh.
even for me. I'm like, but it's cold out there, so yeah, that's kind of a not fun part of it. So
Wow. Okay. Well, so you just get bundled up and just go out there.
oh yeah. So it's so funny. I took a picture of it not long ago. It's like this big red feeder. It's like a hay feeder.
Okay.
My husband gave it to me for Christmas one year, and like my friends were like, "That's crazy." I'm like, "No, that's the best present I've ever got," because it's like I don't have to go out and feed. It's
Yeah.
just they can feed
Yeah.
themselves. That was really thoughtful.
I love that. All right. Well, let's transition a little bit
Yeah.
into talking about your work with Smiles Across Montana. Just briefly tell us, like, how did that begin, and what is Smiles Across Montana doing in this area?
So I grew up in an area of really low access to care, and I grew up with grandparents living in nursing home facilities. My brother's intellectually disabled, and it just made sense that when I found out that limited access permit hygienists in Montana could go into nursing facilities, that's the first thing I did. I applied for a grant from the American Dental Hygiene Association. I got enough money to actually purchase, I bought used equipment from a dentist that wasn't going to be working in those facilities anymore. And I actually bought some products off of dental hygiene students also, because I really wanted to make sure that I had everything I needed to go into this facility, so I could use suction and I could have a cavitron. Fast forward a few years, it's my first cousin, she put out on Facebook, she has Indian Health Service as her insurance, and she put something on Facebook about how she waited all day and she wasn't able to be seen. And I was like, no way, I could see you.
Yeah.
And so I tried to work for Indian Health Service. It was really hard with the way some of the contracts go, but I was able to take a part-time job working for the Fort Peck tribes. And I remember the first day that I worked there, I just knew I was going to be doing this forever. It was the most amazing experience I've ever had. Like, if you've ever felt something, I was like, I'm going to do this forever.
That feels right. Yeah.
And from that, you know, working in that, I think I did that for 5 or 6 years. I'd go for a week, a month, and I had the most amazing boss here in Bozeman. He always allowed me to go. I don't know how he didn't fire me because I went a lot. And then I just thought, you know, I was with another hygienist and we were like, we should do this everywhere. Everyone needs this care. And so that's how Smiles Across Montana was born. And it went from like 2 hygienists to now I think we have 17 people working for us. So it's insane. Wow. It's crazy. And you saw today we have a mobile unit. Yeah.
Which is gorgeous.
Thank you.
Congratulations.
That's huge. It was so fun to be in it.
Yeah.
It felt really good.
Well, I know you truly believe that everyone deserves not just access to care, but access to exceptional care, regardless of their financial situation. What drives this commitment and passion in you, and why is that so important to you?
You know, I always want to do everything right.
Yeah.
And I will say something that I appreciate about myself. If I've been criticized about something, I'm not going to like become a hater. I listen and I made it better. So I think that that's been a really kind of not a game for me, but that's been a journey. It's like, okay, what else do we need to do to be better? And I think also just, I was talking about it earlier, manifesting it. Like I really believe I'm going to play a big role in improving oral health disparities in our country. I think it's so important that, you know, dental providers are seen as part of the healthcare team. That's really, really important. We do a lot of work with MSU and the nursing department. We need to be looking at people's whole health, and if people aren't getting exceptional care, if they're getting just okay care, it's not good enough.
Yeah, yeah.
And I guess that just drives me. It's like, I feel like I'm a fairness freak in a way, but it's more, this is what's right. And if you've ever seen yourself be able to do something about something, it's definitely a high you want to keep all the time.
Yeah.
So.
Well, and you're providing these families and kiddos and everybody dignity, really, at the end of the day. Isn't that what it is? Because it's not just okay or mediocre care. No, you're giving them dignity so they can walk in and be treated like any of us do at our dental practices that we go see in our dentists. So
yeah, that's totally true. I just like dignity, such as like thank you. That's a beautiful word. I love that. Thank you.
Absolutely.
You know, I've been doing this for a long time. It's funny, you do just get choked up because you think of how hard it is for some people to get treatment and some of the barriers, you know, some of the things that my team has done. Like if, you know, you might have a grandma who doesn't feel comfortable calling an office to schedule an appointment, and I just have this amazing, loving group of really understanding, humble, like the humility on my team is just amazing. Sorry, my dog is now licking the concrete. He's got issues. It just sounds so bad.
No, I know. I
don't want anyone to think that we sound like a bunch of
like pigs or something.
Sorry, we're both worried about how we sound. I'm like, oh my goodness.
Oh shoot. Okay, we were having such a moment. Okay. Well, I'm a huge believer in the power and importance of storytelling and the magic that happens when we share authentic stories. Can you share a short story of a patient that you've served that experienced like just radical life change, you know, physically, you know, probably self-esteem, emotionally?
I can actually talk about something I saw in the school-based programs years ago and how I just knew how important this was. There was a child whose parents really were having a hard time getting him signed up for Medicaid. They had, you know, tribal health service, but they weren't able to get their child to be seen. And it was, this young boy had so many cavities and he was in so much pain and he was so deathly afraid of us that was really hard. I remember thinking, like, does he have some cognitive delays? Is there something going on? And over the course of it took quite a while, but he was able to get his full mouth restored. And I remember the first time I saw him after that, I wouldn't have recognized that child. I would have never recognized that child. He was like a completely different child, thriving, talking. I mean, he wasn't afraid of us. He was happy to come back. I
So
just
he
can't
had-
imagine what it would be like to have that much pain. And so
Yeah.
what we've seen a lot in the work we do with silver diamine fluoride and glass ionomer and different tools like this, and how important it is, we'll have kids that are never going to be seen at a dental office, and every time they eat, they're packing food in their teeth. They're packing food in these holes. And the best we can tell the nurses, if we don't have a consent, is we'll make sure they brush after they've eaten lunch. That'll get them, out of
Yeah.
some pain.
Yeah.
We give them toothpicks and floss picks and floss, and like these are some things that you can do, but it's amazing to be able to actually do something for someone
Yeah.
that would never be getting that treatment if not.
Well, I love that the fear went away because you guys took such good care of him,
Yeah.
and your team did. And
Yeah.
then he can move forward having a healthy mindset or even perspective of
Well, and
like,
just being healthier. Like
Right,
if you
right.
have chronic inflammation going on in your mouth, and if you have cavities all the time, you are not healthy. It's
Yeah,
like running
yeah.
through your bloodstream.
Yeah.
You don't. A lot of kids don't die from cavities, but when when they're adult teeth, you can actually die from an abscess in your teeth. So, and it happens. It still happens. It happens in America. I think that's something that a lot of people don't realize.
Yeah. Well, I know I've heard you share about having a real passion to potentially duplicate what you were doing in Montana and take this model and possibly take it, nationally or wherever it will work and is needed.
Yeah.
Can you share kind of your heart for
Yeah,
that future?
I feel, again, I said it earlier, but I feel like I listened to people's issues with our program. I listened to things people were concerned about, local dentists, area dentists, parents, communities, what people really needed. We really listened, and we implemented strategies that would work for that community. Our goal is if we go into a small town and we have an awesome dentist taking Medicaid and seeing people, but just can't get all those people into their office, because there's a lot of reasons. You could be across the street and you might not be able to get that patient into your office. So we've done a lot to not just protect us or our patients, but to protect whole communities. And I feel like I love the way we do things. I've tried to stay one step ahead in everything. I'm always trying to learn and to introduce new things to our team, and it's just really exciting, and I feel like we're doing it right. And I feel so strongly about doing things right that I want to help others do it right.
Yeah. I love, just on a personal note, just when I've seen you on stage, and you're such a I feel like you're such a teachable person, but you are also such a strong educator. And I think sometimes the best educators are also still curious about the world around them. And I noticed that about you.
Yeah.
Have you always been like that?
Well, I feel like I could be humble. When I first started, we were a lot more direct access, and for our team and for me, I was like, well, what's best for my patients? What could a dentist bring? What could they add? And so now we have quite a few dentists. And this year, I've been talking about it all day, but he's actually here. We actually have worked out a contract and are working on even more like grant funding. We're adding a full-time dentist next year because of like what I talked about. Even with our really extensive referral system, we're not able to get some people care, so we're going to bring it to them.
That's so awesome. Wow. I want to ask you just a quick question about being a female dental entrepreneur.
Yeah.
Okay, because obviously we know in the dental profession, and really any profession, being a female entrepreneur has different challenges than if you're a male entrepreneur. And we love all of our good male entrepreneurs out there. There's a million of them. So it's not, I'm not taking sides. But tell us about one of the biggest challenges that you think you've faced as a woman dental entrepreneur. And then what did you do to work through that to the other side?
You can tell I'm kind of sensitive. So I remember when things would first come up, barriers to access to care, barriers that I had to work through. I would get I would cry. I'd want to throw a fit. I don't think that's a woman side of me. I think that's a Crystal side of me, a very passionate side of like, why are there so many barriers?
Yeah. Like when you were growing up or when you got into the
No,
profession?
when I was in the profession.
Okay.
And so essentially, you know, I had a friend one time, she said, I told her about something that was happening to me, and she's like, oh, that's awesome. You're a pioneer. And I was like, I don't want to be any of these things. I just want to do good stuff. I don't want people looking at me, accusing me of doing something wrong, because there was a little bit of that. Like, you know, dental hygienists as entrepreneurs, you know, that isn't a very easy field. And I love dentists. Like, I love everybody. So I wanted to be loved. And I think the hardest time was sitting back, knowing how I felt about something, but actually listening to the other side. That was big for me.
Yeah.
Like, I grew a lot actually listening. I think at the end, I talk a lot, so that was hard, you know, listening to, you know, because I want to be one step ahead of everybody. But I would also say something that made me feel so supported, and I really feel like it was a game changer. We talked about earlier, but never had I, as a dental hygienist, I have a lot of dentist friends, a lot that are women, but I'd never felt so supported as I did at like sitting next to people from the industry, but other, you know, women dentists that were just like, I love what you're doing, and like telling me they would support me, and it was amazing.
Yeah.
Thank you, Ann Duffy. I feel like
Ann.
she's like the fairy godmother of everything. Like,
she's
thank
here
you.
with us in spirit.
We should have like signs like, thank you, Ann Duffy.
Absolutely. Tell all of us something that you feel proud of with all the work you're doing. If you had to pull like one thing that you're like, you know what? Because I think so often we have this inner critic always constantly going on, that we're not enough or haven't done enough, or we haven't, you know, this hasn't scaled enough, or whatever it is, as business owners or nonprofit, you know, founders. But like, what's something you feel proud of?
Yeah, in my work life, I know that a lot of people weren't happy in their jobs, and when my people are happy in their jobs, like sometimes some of the hygienists or assistants will send me like a note and telling me thank you, and it always seems to come at like the right time. Like when they've said that to me, like, thank you for creating this, I get to do this work that I love. So like that was huge, because you hear a lot about burnout in the industry, and if someone's in a place that they shouldn't be and there's somewhere else they could be, I think that's what I'm the most proud of. And they're proud too, I guess, the horses. I don't know if you heard them, but I might not be able to hear that, but it's pretty loud. But I would definitely say, like, I'm super proud that I can help other people fulfill their dreams too. And now I feel like I'm creating leaders too. At first I was just trying to muddle through it on my own, and now I'm finding ways for them to branch out, because I'm finding they're good at a lot of stuff that I'm not. So.
That's awesome. Well, as we wrap up, I just would love any last words of just encouragement for any aspiring entrepreneur in the dental profession that is thinking outside of the box, that is kind of maybe has a crazy big audacious goal out there.
Yeah. So I would even say, like, even if you don't have a goal, because I didn't really have a goal. I just wanted to change stuff. I didn't like the way things were. I thought, oh, I could help with this. This would be amazing. I didn't even know where I was going. I feel like don't limit yourself, and you need to find your people. Like the people, I think support is the biggest thing. I feel like there were a lot of times when I couldn't sleep at night, and you know, if I would have done it alone, you know, I co-founded Sam, and you know, it was nice to have someone else. And then when we brought more people on, it's always been great to have the team, but then also like going to the mobile conference, I go to a lot of meetings, and it's amazing the support you find there. Like, we have a lot of amazing humans in dental, a lot. And I think sometimes we get disgruntled, and if you're feeling that, like, I think we all probably think about mindset a lot, you know, and it's about your attitude towards people and your beliefs. And if you choose just to stay out of the weeds, you're gonna be good.
Yeah.
So
Just follow your heart, right?
Exactly. Yeah. And I truly believe that people are good.
I love that about you. Crystal,
Yeah,
you have a
thank you.
beautiful heart. Thank you for
you.
being my guest on this podcast, and also for just opening up your home and your dream to our team today, and letting us capture the story of Smiles Across Montana. It's
No, thank you. It's such an
truly a
honor.
privilege,
Today's been super awesome. Sorry.
You're amazing. If our audience wants to stay in touch with you, follow you, what's the best place to connect with you?
Yeah. So
On social.
on social, it's Crystal Loves Dental and Smiles Across Montana. And our website is smilesacrossmontana.com. Or, yep, that's what it is.
Yeah,
Still, yeah.
it's amazing.
Thank you guys.
You're amazing. Thank you so much,
Sorry.
Crystal.
I'd be
Never ever. No, my podcast is for like authenticity and crying and laughing and being real. So
Thank you.
thank you, Story Project podcast listeners. We'll see you next time.